And here, Dr.
Welcome, Dr. Padmaja.
Uh, hi, Dr.
Dr. Khan.
Shanti.
Yeah,
Yes,
yeah,
yes, I can hear. You all seem to be traveling.
yeah, yeah. Uh, uh,
Yeah, this is fun.
Karthika Meera join பண்ணிட்டாளா?
இன்னும் இல்ல மேடம்.
இல்ல யாராவது இது
வரல மேம்.
எல்லாம்
தீபா
start
ஜாயின் பண்ணிட்டாங்க மேடம்.
பண்ணிடலாம்ப்பா. ஸ்டார்ட் பண்ணிடலாம்.
Okay.
டைம் ஆயிடுச்சேப்பா.
Shweta, shall you go live?
Yes, we are live.
Hello.
Thank you, Sakshi.
Yes. Good evening.
A very good evening to all present here. We invite you all for the webinar on regeneration and menopause today. Thank you all for joining. And I now invite Dr. T.K. Shantiguna Singh ma'am, our President CMS.
Okay, ma'am. So, good evening to one and all. It is indeed my pleasure to welcome all of you all.
Healthcare delivered by.
Yeah, no, that is fine, ma'am. It is indeed my pleasure to welcome all of you all to the webinar on regeneration and menopause. We know that senescence results in ultimately in menopause, and also senescence results in cellular arrest, which leads to organ dysfunction. So we have lot of scope for regeneration now, and hence we have opted for this webinar on regeneration and menopause in various organ systems. I have great pleasure in welcoming our chief guest, Dr. Padmaja, who is the former President, Vijayawada Menopause Society. They conducted an excellent conference. We were happy to participate in that. And I also have Dr. Rekha Kurian, our past Vice President Foxy, who is also one of our own, to have her as a guest of honor. And I welcome all our erudite chairpersons and the speakers who are going to enlighten us. And of course, my pleasure to welcome all the delegates too in this pleasant evening. Thank you.
Thank you, ma'am. I call upon our Secretary of CMS, Dr. Meera Raghavan, ma'am, to offer the Tamil Thai Vartha and midlife prayer.
Sahiti, Tamil Thai வாழ்த்து போட்டு
டார்கெட் போட்டு போடு. டார்கெட் போட்டு போடு.
Sahiti, are you there?
Yes, this second, there is some.
Or why is it not working? Sahiti?
Ma'am, we are available, ma'am. 1 second, ma'am. Just the net is the problem, ma'am.
Okay.
1 second.
Can you please share? I was having some network issues.
Yes. 1 second.
போட்டா நம்பர்
வச்சிருக்கியா கலை?
இருக்கேன் மேடம்.
இல்ல நீ வச்சிருக்கியா? தமிழ் தாய் வாழ்த்து இருந்தா அதையா போட்டுக்கலாமே. மெல்லிசா இருந்தாங்க.
கிட்ட இப்ப எப்படி கனெக்ட் பண்ணணும்னு தெரியலையே மேடம். இருங்க பாக்குறேன்.
Can you
நான்
hear
வந்துச்சு.
now? Shanti ma'am, can you hear the song, ma'am?
It's breaking up. I think the network connection is not running well.
Sahiti, can I share?
Yeah.
Yes,
Please
yes,
do, ma'am.
please.
Okay, okay. Yes, ma'am. Yes, ma'am.
Hello.
ஓபன் பண்ணுங்க.
Thank you.
படிக்கணும்.
May I please request Kalamani madam to please
Yes, ma'am.
lead us the midlife prayer, madam.
Yes, ma'am. We pray to God to give us grace to accept the midlife physical changes and gently renew our strength. Guide our heart, our mind, and body to navigate the way and our trust in you to lead us safely through. We pray for midlife and mature women who cherish the fond moments of their life and also for those sitting in a doctor's office or who are in bed asking for healing touch. On this day, may all the midlife and menopausal women have the gift of joy, hope, and good health. Thank you, God, for the promise of hope you hold out all midlife and menopausal women and inspire us to give this gift of hope to others.
Karthika?
Next slide, ma. Sahiti.
Yeah. You will kindly invite Dr. Padmaja, ma'am.
It's an honor to have amongst us our past president of Vijayawada Menopause Society, Dr. Padmaja Veera Machineni. I request our president, Dr. T.K. Gunashiti ma'am, to Shanti Gunasingh ma'am, to kindly invite and introduce Dr. Padmaja for the meeting to deliver the chief guest address.
Madam has already introduced me. Thank you, Dr. Shanti, for the invitation.
No.
Sahiti, can you share the slides, ma?
ஆடி வராது நம்ம பேசுறது.
பண்ண முடியும். There is something at home.
Previous slide, pa. Previous slide and madam slides.
The Nitya. The Nitya.
I request Shanti ma'am to please introduce Padmaja ma'am.
It is my pleasure to introduce Dr. Padmaja, who has won lot of awards. Her awards are a long list indeed, including the Times Icon Healthcare 2023 Award. And she has lot of publications to her credit, and her special interest is cell biology, reproductive endocrinology, which seems to be the deal with today's topic. And she has held various positions. She conducted an excellent conference, and we were also part of it. And she's a member of various committees of Foxy Endometriosis Committee, AIDS Committee, and active member in AP Private Nursing Homes Association too. Welcome, Dr. Padmaja. I would like you to give the chief guest address and also release our model menopause associated disorders awareness letter, which is our routine. Now it is in the 16th edition. Dr. Padmaja, please.
So it is indeed a pleasure to be among all of you. And I really loved your video highlighting the beauty of Tamil Nadu. And I feel that we should always take pride in what we have, because many a time we think that we are only running after what we don't have. So what we have is also so beautiful to be loved and cherished. And I really liked your prayer, and it's great to be with you all today. The thing is, our preparation for menopause should start ideally in utero. So, a healthy woman, a healthy baby, a healthy childhood, and a lifestyle is what lets us move through life in toto as a complete person. And it's always said, even in our scriptures, that we are what we eat. So gut health is really assuming, I mean, people are coming to realize that what was told in our scriptures, that wisdom has a scientific basis. It is just that we did not know, and we just threw away everything, and now we are reinventing the wheel. Like how we say mind body exercise, yoga is the best. I don't know, in school, if you knew that we used to, teacher used to, whenever we didn't do good marks, they used to hold the ears and sit up and down. Now they call that it's one of the yoga. So I think we need to have great terms for what we used to do always, and the wisdom. Thank you for having me here, and I look forward to this wonderful webinar and learn new insights.
Yeah. Sakiti, can you post our Huddle 16? Request Dr. Maja to release it.
Yes, madam.
Our e-newsletter.
Yeah, that's great.
So, ma'am, there is some network issue.
Yeah, no problem.
Okay.
We'll do it at the
Okay,
end.
fine, fine. We'll post it later.
Yeah.
And okay. Now, Kartika, can you please invite
Can you please
Dr.
introduce and yeah. I
Yeah.
now request TK Shanti ma'am to introduce and welcome our guest of honor, Dr. Rekha Kurian ma'am, our past Vice President Foxy, a renowned consultant from Joseph Nursing Home. Right.
She's just joining, ma'am. She just called me. She's just joining.
Okay, then no. Shall we go on to the next part then? Will she be joining immediately?
She's joining, ma'am. She's got the link in the morning. She just called me. She's just joining.
No, then probably we'll go on to the
Sessions,
first talk. Huh?
Yes.
Rekha has joined. Kalai, can you find out?
ma'am. 1 minute பண்ணுங்க.
Okay, Pa, then I think,
Ma'am, can we invite the session chairpersons, ma'am?
yeah, please.
Yeah.
Maybe after the first talk, we can introduce her. Oh, yeah.
Sure, ma'am. Sure. I
Yeah,
now invite the chairperson for the session 1.
you can
It's an
introduce
honor
them.
and privilege to invite Dr. Kartika Prabhu. Madam is a professor in SRM Medical College. She's done her MBBS in MMC and MD in JIPMA, and she has special interest in high-risk pregnancy, gynec endoscopy, and midlife health. And she has won various awards, and she has published in 24 national and international publications. And she is a credential IMS menopause practitioner. Welcome, ma'am, to as chairperson to the session 1. Next, I would like to invite Dr. Mala Raj. Right. Madam is a joint secretary of CMS and founder secretary of IAG Tamil Nadu chapter. And Madam is a renowned lab surgeon has numerous awards to her accolades. And she's won the Best Doctor Award from the Tamil Nadu Medical MGR University and Dr. Satyapal Award for Excellence in Minimal Invasive Surgery from IOG in 2022. She's currently the managing director of Firm Hospitals. Welcome, Madam. Next, I would like to invite Dr. Rajshri, Madam. Madam is a life member of FOXY, IFS, IMS, and IME. She's a member endocrinology committee FOXY, and she's currently working as a consultant in Apollo Medical Center, T Nagar. A special area of interest is preventive women's health, and she is a contributor to the Management of Labor 3rd edition textbook, currently used by the postgraduates and practitioners. Welcome, Madam. I kindly request the chairpersons to introduce our speakers for the day. The first speaker is Dr. Priyanka, Madam.
So the gut microbes is a recent topic for research. Actually, it plays a very important role in health. So most of the research is now focused on gut microbiomes, how it causes pathology and how we are going to treat it. So as women approaches menopause, there is also a change in the gut microbes. So we have with us to enlighten us on this topic, Dr. Priyanka Udawat. She is actually a pediatric. She has done fellowship in pediatric gastroenterology, hepatology, and liver transplantation. She is a consultant in pediatric gastroenterology and preventive healthcare and wellness. She has more than 13 years of experience, and she has her areas of interest is on food allergy, pediatric endoscopic interventions, and holistic healing. And she has a lot of publications. Ma'am is going to now enlighten us about gut regeneration in menopausal transition and in menopause. Over to you, ma'am.
Thank you, ma'am. Thank you, the entire team. And I'm really honored and privileged to have talk here. And this is my passion to work on gut health. I'll be sharing my slides. Can I share now? My voice is audible?
Yes, ma'am.
Yes,
Audible,
ma'am.
ma'am.
Give me 1 second. Can you see my slides?
Yeah, it's visible, ma'am.
So I'm working in HN Reliance Hospital, Mumbai. So started with pediatric gastroenterology, but my main work is GI wellness and gut health, apart from pediatric gastro practice. And as a lifestyle medicine physician, I try to incorporate even yoga, meditation, and complete diet change with each and every patients, if they are pediatric or in adult patients. So that's why I thank Dr. Meera ma'am for giving this opportunity and this platform. And while making this talk, I realized that how important it is even for menopause, not just other things. So we all know that it was 2000 years ago, even Hippocrates said that all diseases begins in gut. So definitely there is something why we all say that, because of gut microbiome. But why we say gut microbiome is so important? Because if you see the microbial cells and human body's cells ratio, it is equal, 1:1. And if we think of microbial genes, they outnumbers the human genomes more than 100. So the ratio of microbial genes to human gene is 100:1. So their genetic content is more than our own genetic content in our own body. So actually, I always say that we are living on the gut microbiomes. They are not living on us. So what type of gut microbiome we are having that decides the entire health and even mental health also. So any of the imbalances in compositions and functions, we will get localized GI diseases to neurological, respiratory, cardiovascular, and hepatic diseases. And when we have the talk here is more particularly on the menopause, but I will just share a few 2-3 slides regarding gut microbiome because we should understand little more. So if we see, gut microbiome displays a sexual dimorphism. So according to sex hormones, the gut microbiome overall, it is different in men and women, pre-menopause and post-menopause. And we all know that estrogen regulates many of the processes in the body, in brain, skin, musculoskeletal, and cardiovascular system, also apart from the reproductive area. So there is an interconnection between the gut and the estrogen and estrobolome. So if we see the gut microbiome, we cannot think of gut microbiome in isolation. We have to think with the holobiome, where we have to live in the co-evolution with the environment also. So if you're having a commensals healthy bacteria, you are into symbiotic state where you have good metabolic collaborations and high bacterial diversity. Okay. But if there is an antagonistic ovulation where the lifestyle is bad, diet is bad, antibiotics are there, a lot of non-veg food, then you have more opportunistic, more pathogens in the gut, and that will create a dysbiosis and low diversity, which will create a state of pathobiome. So once we reach, when we have to correct gut microbiome, we have to think holistically. So what happens? What is microbiome? So gut microbiota, and whatever they produce, they are microbial structural elements like peptides, lipids, and polysaccharides, and then nucleic acids, short chain fatty acids, all together is microbiome. Okay, so here the environmental conditions will affect the genetic signalings also, and finally even epigenetics also. So we need to focus that we are carrying the good once, and then we are carrying the healthy metabolites to govern our entire metabolism. So there are a lot of factors we all know, starting from birth in utero, as ma'am said, from host genetics to breastfeeding to drugs, antibiotics, and environmental, especially nowadays the diet, which we will discuss later on. And finally, these bacteria produces short chain fatty acids, bile acid, endotoxins, inflammatory response, and immunity response. So how we think of now gut microbiome as a therapeutic, because this has a potential at cellular level, genetic level, and then we can alter the metabolic pathways in our gut. So we have now different kinds of research going on, which initially started just as a bacteria. Now there is metagenomics, metatranscriptomics, metaproteomics. A lot of research is happening in this area, and still we are evolving and learning. So now the One Health concept, which is by WHO, if we have to correct that gut, we have to correct the food. That means we have to correct our soil. We have to correct the entire ecology. It cannot happen that if you eat a bad food and then you have a healthy gut. And the bad food will always come from the environment. So we need to be in a sync with the entire natural elements. So that's why it's in One Health complex, where we have to work on bioeconomy, environment, and microbiome all together if we have to really work on a precision treatment. And in between, definitely the entire research will go through mice models and then to the human models. If we talk of the gut hormone axis, it starts from oral microbiota. Then you have gut microbiota, then we have vaginal gut vagina axis, gut oral axis, and then we have gut brain axis. All these are getting affected through hormones, and definitely included sex hormones also. So how the menopause is connected with the gut microbiome? Because the dysbiosis in the type of bacteria like firmicutes and bacteroids, it has been what it has been shown that these bacteria increases the beta glucuronidase activities, which is the enzymes which resides in the microbes, and it influences the estrogen metabolism. Okay, so all these microbes which actually governs the estrogen metabolism is known as estrobolome. So these beta glucuronidase, which is produced by microbiome, they actually deconjugate the estrogen metabolite. And again, estrogen is reactivated in our system through enterohepatic circulation for the entire health, for the hormonal health especially. So here in this diagram, you can see that the estrogen which is coming from ovaries, adrenals, and adipose goes into systemic circulation, it goes into liver where the conjugation happens. But once it comes into the gut through biliary secretion, there is a deconjugation process happens by this gut microbiome. So again, this deconjugated estrogen can get into liver and systemic circulation. So we are again reactivating the estrogen. That's why we are saying gut regeneration is basically key to menopause, because when we don't have from ovaries, we still can preserve and reactivate. That's where we have to work on. So so the gut hormone axis basically works in bidirectional relationship. Okay, so where the sex hormones appears to impact on the gut by resulting in sexual dimorphism. The gut microbiota also involved in regulating the free circulating hormone levels by this bidirectional relationships. And the glucuronide and sulfate conjugations which happens in the liver through, and then it comes through biliary secretion into the gut, then the deconjugation by microbes takes place. So if we see during aging, we see here that the concentration, we all know the estrogen progesterone will go down, but if we compare with the gut microbiome, with aging the microbial diversity is less, and estradiol and progesterone itself actually prevents the GI barrier permeability. You know, it makes the GI barrier intact. So when this goes down, there is a leaky gut. If you see here, here the bacterial translocation is happening inside once we are achieving menopause. So again, both affects each other. So another thing very important when before we start the menopausal symptom, that immune system pro-inflammatory cytokines are getting released. So whenever the gut is on whack, the immune system starts becoming confused. How that happens, I'll tell you in very easy slide here. So if you see here, we have these gut bacteria. This actually secretes short chain fatty acids, vitamins, and probiotic metabolites. Now, this actually reduces inflammation and improves the barrier functions. And this actually activates the T regulatory cells. Now, T regulatory cells is basically everything happens in the gut by gut microbiome metabolites. If this anti-inflammatory cytokines goes down, we have an inflammatory state in the gut, and then we get a lot of inflammation, autoimmunity, allergy, vasomotor symptoms, and lot more. So this all is getting governed in the gut microbiome in the gut. So we have to now work on that, how we can create a healthy bacterial metabolites. And one second. Can you see my slides?
Yes, Dr. Priyanka, we can.
Yeah, we can.
So you can see how immune system, so 70% of immune cells are in the gut. So immunity needs to be maintained, inflammation needs to go down during menopause phase. And we all know when the reproductive phase, because of the hormones, we have healthy gut microbiome, bone health, cardiac health, muscle strength. But the moment menopause happens, this all goes on toss. And finally, we get all these symptoms of thinning of hair, hot flashes, bone loss, rapid osteoporosis, sexual dysfunction, dry mouth, dry vagina, all these symptoms because of these. So to prevent these, somewhere we have to maintain this estrobolome so that we have right amount of beta glucuronidase to maintain these estrogen levels in balanced amount, okay, via deconjugation. That means we should have a healthy gut bacteria to do all these stuff. I think we are clear up to that. So now human gut bacterial beta glucuronidase have shown in vitro to deconjugate these estradiol, and then this give a proof of principle that human gut microbiota can reactivate estrogens. Okay, and this is a new idea how we can maintain postmenopausal some amount of estrogen. And there was a study in women health across nation where 65 women, what they found from pre-menopause to post-menopause, their plasma intestinal fatty acid binding increased, which is a gut epithelial function, and then lipopolysaccharide binding, which is the marker of microbial translocation. So all these factors are getting affected from pre-menopause to menopause in the gut. Okay, and then CD24, soluble CD24. This is a marker of immune activation for microbial translocation, when there's a leaky gut. So when the plasma estradiols are low, these things are higher. So again, there's a connection. Now, there are some studies I'm showing where you can see in the menopause, sex hormones, and gut microbiome. So this was done in the Spain, where you can see premenopausal and postmenopausal. One second, there was a call. So premenopausal and postmenopausal women, they did gut microbiome analysis, and what they found, the postmenopausal, their microbiome becomes similar to men, not like women. Okay. And in another study, again, the same thing, the diversity got lost and more bad bacteria got proliferated. So these are the studies which shows that there is a lot of connection in gut microbiome and the bacterial diversity which changes post menopause. Now this study, these are the studies where they have not checked the sex hormones, but they have checked the gut microbiome post menopause. So what they found, that alpha diversity, firmicutes, rheumococcus, all these are getting low, and this increase glycolysis, lactate consumption in the gut, okay, it is increasing. So metabolism, gut metabolism is changing during post menopause. So what we have to do now? We have to finally, if we want to have a healthy menopause, definitely by all these slides, we are sure that we need to maintain the gut health. But what are all the steps? How we can improve gut health? What are the practical steps? So there are certain studies where they are working on lactic acid bacteria, which is a probiotic. It's a very promising tool in menopausal health management. So we all know that when the women's body goes through menopause, there is an immune change and there is a lot of oxidative stress. And because of ovarian functional decline, there is a lot of pro-inflammatory cytokines are getting released, like interleukin 1, 6, TNF. Okay. And so there is a state of inflammation also. And this lactic acid bacillus, they have been proven to treat inflammatory bowel disease, mucositis, and they have an immunostimulatory property. I have already told you how they do through T regulatory cells. So when there are a lot of studies in lactic LAB, if you see plantorum, when they gave with the soy milk, they found that they produce a lot of beta glucosidase. Okay. And they actually optimize the isoflavin bioavailability. Okay. So when you're giving soy products with probiotics, again, there is a difference. Then there is another species of Lactobacillus sporogenus, which increases the intestinal absorption and bioavailability of isoflavin. This was also one of the study, and it alleviated a lot of sleep related issues in postmenopausal women. And then soy milk, if it was fermented with plantorum, what they found that it was having decreased serum osteocalcin concentration. So it was preventing osteoporosis. So if you are supplementing probiotics and maintaining gut health in postmenopause, a lot of soy and isoflavin metabolism is getting affected, which is in the healthier side. So another study, that LAB supplementation influences the estrogen metabolism by regulating the estrobolome. Okay. And then there are indirect and direct pathways which regulate even hypothalamic pituitary hormones also. So you can see now And some study says that regulatory effect of lactobacillus on estrogen synthesis in extragonadal tissues. So this may be the new idea to improve estrogen deficiency in women during menopause through dietary regulation. So now diet is very important to correct the gut, because every bite what you eat either is creating a state of disease, either you're feeding a disease or fighting with the disease. So if you are having junk food, you are actually feeding the disease, but if you are having plant based diet, you are fighting with the disease or any inflammatory or menopausal state. So what happens, the role of diet on the gut microbiota, because we have to maintain a gut eubiasis. So if you are having more junk food, more processed food, more non-vegetarian food, you will have a dysbiosis. But if you have more plant-based food, you will have a symbiosis. So mainly prebiotics, fruits, vegetables, all these will increase your bifidobacterium, Bacteroides prevotella, and the ratio will be in the healthier side. So now if we compare, if we see the research in postmenopausal vasomotor symptoms, what they have found in women health initiatives, that low-fat diet rich in whole grains, fruits, and vegetables increase the chances of women to become free of hot flushes at 1 year by 14% if they have achieved some weight loss, and 23% if they have achieved more than 10% weight loss. So basically, to reduce menopausal symptoms, you have to have an ideal weight by having a good diet. Then another study, again, it showed that gut microbiome composition gets changes, and there's enhancement of growth of gut bacteria, which converts diazine to equals, which are the estrogen receptors beta agonist. So if you have plant-based diet, you produce more equal compared to an omnivore and a non-vegetarian diet. So again, it favors the plant-based diet. There was a 12-week randomized trial. They gave low-fat plant-based diet, including soybeans, and they found moderate to severe postmenopausal hot flashes were decreased 88%, and 50% were completely free of the severe hot flashes. So these are the exact research which is happening in this area. This was one of the study where they have done the dietary interventions in postmenopausal women, low-fat vegan diet with cooked soybeans daily around 86 grams, and or one intervention was there that, and one was a usual diet. So after 12 week of period, they found to see, they were seeing what is the frequency and severity of hot flushes, and they analyzed the gut microbiome also by metagenomic sequencing after this dietary intervention. So this is the post women. So they have given the plant-based diet, and then there were a lot of significant change in their gut microbiome. So what were the changes? That hot flushes went down, and there was a significant change in gut microbiota, especially Porphyromonas and Prevotella species correlated with hot flushes, and there were changes in Clostridium, which also correlated with severe hot flushes. So they did all this correlation also. So if you see, vegan diet decreased the menopausal symptoms. And this is the same study results. So Clostridium, when it is decreasing, there is an healthy change. Even there are other studies where cardiovascular health is getting improved, because these Clostridium actually produce trimethylamine oxidase, which actually is the proatherogenic metabolite. So vasomotor symptoms and cardiovascular diseases are more with this bacteria, which goes down when we eat more vegan diet, more plant-based diet. Then one more bacteria, Erythropelotoclostridium. This also had greater abundance when patients were on hormone pills. So again, this was increased in this study. And then this one more probiotic, one more bacteria, Fusicenitobacter. This creates an anti-inflammatory cytokine. It reduces CRP, and it can be modulated by a lot of prebiotics like guar gum in menopausal state. And this fiber fermenting bacteria is capable of producing a lot of short chain fatty acid. It has role in preventing even neurodegenerative disorders. where there is a role of even autonomic nervous dysfunction. So both in menopausal state and Parkinson's, this has proven to shown a beneficial results, and this was also shown this in particular study. So you can see how these things are changing our menopausal state here. And these fibrous foods, basically what they do, they have a greater satiety when we are eating more fruits and vegetables, which lead to weight loss. And I have already told you weight loss itself will decrease the menopausal symptoms. And one more bacteria called Holdomonella correlates with elevation of food addictive behavior if you have food cravings. Okay. And it was associated in weight loss cases, it was associated with inverse association with android fat ratio in the males. So it helps in metabolic syndrome also. And this plant-based diet, they are low in advanced glycation products also. Advanced glycation end products are more with animal food. And what these advanced glycation products does, they increases oxidative stress and mitochondrial dysfunction, which leads to more inflammation. So you can see how bacteria are changing and creating healthy menopause with certain studies and certain parts of I've discussed. Now the rapid bone loss. How this happens post-menopause, we all know because of estrogen. And apart from this, there is the release of pro-inflammatory cytokine. Then again, endocrine system gets affected, calcium balance gets affected, and finally the bone metabolism. So even lactobacillus has shown here also a lot of improvement because it maintains a low pH. So it increases the availability of calcium. Okay. So it improves the calcium absorption in the intestine. And because it activates, there are some active peptides by lactobacillus, which can help release of minerals from the insoluble ions, thereby increasing the mineral absorption also good. So that's how they prevent osteoporosis. And this LAB actually works on immune system also. So it attenuates the increase in osteoclastogenic factors like TNF alpha and interleukin 1 beta. So it prevents, or it at least, prevents the progression of osteoporosis. And definitely T regulatory cells, which I told you, which has an entire, regulation of anti-inflammatory cytokines or pro-inflammatory cytokines by this. So these are certain slides. Now, what is the role of high fiber? So there was a study on mice. If you see here, if you are having if you are having more high fiber diet, the short chain fatty acids are more. So this study basically shows a germ-free mite, then a high fiber mite, and only probiotic without high fiber. So if we have more high fiber diet, then the short chain fatty acid production in the gut is more. So what it does, it basically it shows that if you are having a probiotic but you are not working on your fiber diet, then the results will not come. So you are supposed to have a high fiber diet if you want a good gut bacteria and their metabolite production. So how we can improve the fiber and having a good weight loss diet? By adding millets to your diet. So millets will lower the cholesterol. It will help in weight loss. It optimizes the immune system. How all it millets does that? Because it has an high fiber, higher digestibility quotient, and it is rich in a lot of minerals also. And then a lot of antioxidant properties also millets have. And why I say millets? Because nowadays wheat and rice are completely, they are removing the brands where the entire fiber and B complex is there. But millets we can still get whole. So it is always important if you are talking of gut health to mention millets. We have different millets. Okay. And this is about the finger millet. It has good dietary fiber, which will change your gut bacteria and flavonoids. So different types of bacterial change will happen, and it will reduce lipopolysaccharides and anti-inflammatory cytokines. So no leaky gut, no bacterial translocation, and it will modulate the immune system. So these are the additional benefits apart from cholesterol and sugar lowering properties and weight loss properties. So we have major millets and minor millets. Minor millets are more good, I feel, if you have gut issues. And there are a lot of studies which suggest that millet-based diet, their average cholesterol, their average sugars, everything, their average BP was less versus non-millet-based diet. And if we see why we say this, so if your lipid profile, sugar and metabolic health is good and you're maintaining weight loss, definitely we have already seen that gut health will be better. So this is one of the thing. And if we see the glycemic index of millets, we have, see, if you see here, white rice is 41, okay? Finger millet is just 28. So we are improving the sugar control also. That will improve it will help in weight loss also, okay? Soya bean, if you see, it is 22. But if you see, it is almost double. White rice is almost double. So we should always think of glycemic index when we are eating food, because that will add on to the obesity and that will add on to the inflammation. And if you see carbohydrate to fiber ratio, if you see rice, it is 78. So more carb, less fiber. But if you see these millets, foxtail, little millet, you see just 8, 4. They have more fiber, less carbs. Okay. So it will also improve their gut health and menopause. Now these are various consumptions of their compositions of millets. So ragi, you see 350 calcium, highest for calcium, so osteoporosis can be prevented. Protein is good in little millet. Fats are good in barnyard. And then you see here, iron is very good in barnyard millet. So we should eat variety of millet, zinc in little millet. So you can see then vitamin B complexes is more in proso millet. So if we keep variety of millets, we have enough nutrition, enough proteins, enough minerals also. But one more thing important, we are talking on gut health, regeneration, how you're cooking the food. So if you are cooking food on high temperature, you will have more advanced glycation products. And then you will have more oxidative stress, more inflammation. So grilling, broiling, roasting is not good. Boiling, stewing, steaming is good, because that will create less advanced glycation products. Okay. So cooking methods are very important. So finally, the last 4 slides, if the main crux that we initially also discussed, that it's a holistic health, because 80% of premature deaths are happening because of diet and physical activity, poor diet and lack of physical activity. And only 3% of population is actually living in healthy behavior of non-smacking, having fruits, vegetables, maintaining their BMI less than 25, and good physical activity, which is very, very less, only 3%. That's why we are having more symptoms now. So we need to work on lifestyle medicine pillars now, like healthy eating, which we discussed, healthy relationship, mental well-being, physical activity, sleep is very important for entire regenerative and restorative process, and no substance. So if we think the root cause is too much behind these diseases, but I think we should work on now inflammation, toxins, immune balances, working on invisible gut. And for that, you need to have more plant-based diet. And for especially for menopause, you have to maintain good fiber by adding all these in your diet, and good amount of less salt, more fiber. We all know the WHO recommendation, somewhere around 25 to 30 grams we should maintain per day fiber in adults, and less high salt. Nowadays, a lot of chips, crackers, they have very high sugar, high salt, high oily food. That needs to be prevented, because this affects the gut health. A lot of colors, preservatives, thickeners are there, which also changes the gut health. Because of lack of time, I didn't introduce all those slides. You need to increase more calcium in menopause, because osteoporosis is too much. And another thing is we have to work on different kinds of proteins. Protein should be more, because already there is osteoporosis going on. And so we need to have a foundation nutrition prescription. We should have vegetables, fruits, legumes, whole grains, nuts, seeds, low healthy fats like, walnuts, avocados, not refined oil. So this is like an American College of Lifestyle Medicine plate, where you see fruits and vegetables are more, less grains and more plant proteins. So physical activity is the another pillar. All 4, not just walk. You should have muscle strengthening, mobility. So yoga, gym, cardio all together is important. Just one will not suffice, because there's osteoporosis, there's arthritis, we have to work on that also. So there is an exercise prescription also, where we have to actually tell the patient how much to exercise, what frequency to exercise, how to increase the pace. Then sleep, never ever forget, it's the light, food, fluid throughout the day, how much you are getting exposed to screens, what type of food you are eating, how much hydrated you are, that will decide your nighttime sleep. So it's not just unwinding before night, it's the entire day what you are doing. If you are having too much of excess lights in the late evenings, you will have sleep issues, because melatonin will get suppressors, because these are the modifiers. Then finally we have outputs, the daytime alertness. So sleep is very important. Then we all know stress, risky substance, and positive social connections. When we are talking on menopause, we have to talk on lifestyle. So you have to do motivational interviewing, express empathy, what are all resistance are there in that, changing the diet, changing the lifestyle. We have to talk on, a lot of counseling needs to be done to change their lifestyle. And we have to tell them the risk, what is the risk of these unhealthy behavior, why they are doing, why they are coming, what is the roadblock, what, again and again we have to repeat the same steps if we really want to change their life as a whole in toto. And that's where the positive psychology comes, which we have to train, and we have to tell their family to come and see. So when we are talking of gut regeneration, it's not a one person job. It requires diet, exercise, and changing their behavior to change their diet. That's more important. So you will require a team. So prioritize plant-based diet if you want a healthy menopause. Eat a lot of fermented food. You have to feed the good bacteria. It's not just the diet, even the mental health and the physical exercise, and avoid all kinds of sweeteners. Take a lot of rest, and even do some fastings in between. And then definitely supplementations, and pursue testing if you have nutritional deficiencies. So the last side, food you eat can be the safest and most powerful form of medicine, or slowest form of the poison. With this, I will conclude the slides.
Thank you, Dr. Priyanka, for our in-depth, elaborate discussion on the role of microbes, gut microbes for healthy menopause. So you have also stressed on the important factor, that is low-fat, plant-based diet is a preferred one. I think the audience would have got a lot of important messages from our talk. Thank you.
Thank you.
Yeah, thank you so much, Dr. Priyanka. That was a very excellent talk. In fact, you have highlighted that the gut is a second brain. So unless and until you take care of the gut, I think your system is not going to function normally, which was very beautifully highlighted. And so much of research has been going on in this particular field. But only thing is people ask for a supplement. So if they ask for a supplement, what do you suggest?
So the entire focus, actually, when they start asking of supplements, I again go on diet, that minerals are there in this and that. Try to have more natural things, because nature, we are product of nature. So we first 20 minutes will be diet only, where what is calcium rich food, what is, but yes, we have to check vitamin D3 if you're on plant-based diet, vitamin B12, these two will go low. So we have to supplement that. Then definitely, I think you people are more advanced than me in treating menopause. So, calcium supplementation, this is important. But magnesium, zinc also we should think of behind, even selenium. These are the rarer minerals, because we have very monotonous diet. We have either rice or chapati and some vegetables, but we don't include everything. So we should give that. And fish oil, I would suggest, because plant-based diet doesn't have much of omega-6, omega-3 balance ratio. So sometimes we say some fish oil capsules, because if you're promoting plant-based diet. So fish oil, calcium, vitamin D3, B12, and adequate protein, which you have to actually count the calories and proteins what they are eating.
Yeah.
Dr. Priyanka, I have one more question. First, there is a question in the Q&A session. They asked about air fryer. So now that is the latest trend, because it heats fast, no oil.
See, these are all unnatural methods of cooking: microwaving, air frying, high heat baking. Even when I was reading about lifestyle medicine, I used to eat a lot of roasted nuts. Okay. When I read, they said after roasting the almonds, 700 times the advanced glycation products increase in the same nut. Okay. So anything which is high, fast than a natural process for that particular food, it is going to increase. So
Yes.
I would suggest slow heat, boiling, steaming, but if you don't have time, sometimes you can use, but people are using these as a healthy method,
Yeah.
which is say that, a food without oil becoming a dry. That
Yeah.
means the entire dehydration has happened. Cell has becoming dehydrated. That means their entire nutrition will go on toss. It's not the same food.
Yeah, and
So
one more question. There are what nowadays this to lose weight. They say they are going on a keto diet where they're extra. I feel that is the extreme opposite of exactly what you said. In a keto diet, they take oils. They take only animal protein. There is absolutely no carb. So, any comments on that?
So now I'll just tell you, because now I feel that lifestyle medicine should be an MBBS curriculum, because I realized when they taught, and this is not from Indian data, it's an American College of Lifestyle Medicine. So now the US, which used to promote a lot of non-veg, is now creating a data that you should be on plant-based diet. Now problem, what happens, these all kinds of ketogenic diet or what they do, they actually decrease the calories. So somehow you will be able to lose weight and all. But I have a lot of patients for gut health when they do go on these extreme diets. How the fiber and everything should be there in gut, that gets disturbed. So post gut dysbiosis will happen if you are on extreme diets. God has created certain way, more fruits and vegetables in the nature, so we should eat that way only. And grains are energy dense, so the plate should be less with the grains, more with the water rich. Then you don't have obesity, high BMI, PCOS. Everything is coming because we are going against nature. So nature has given six things, and which is nature has produced, that should come to the kitchen and we should cook it and eat it. Rest in between, whatever we are doing with machines and with processing, we are actually changing the gut then.
yeah, thank
Thank
you.
you, Dr. Priyanka. I think any other questions, I request you to answer then and there so that we can continue with the session.
Yes.
As Doctor, thanks a lot. It was really an enlightening talk.
Thank
Has
you.
our guest of honor joined? Kalai?
Yeah, she is joined. Rekha madam has joined, ma'am. Welcome.
Yeah, yeah, yeah,
Okay, I think am I
Yeah,
audible now?
welcome. Yes, ma'am.
yeah, yeah,
I'd
yeah.
like to welcome
Welcome.
Rekha
Yeah,
Varian, the guest
yeah.
of honor for this session. Yeah, over to you, ma'am, to deliver
So,
your.
yeah, I'm very happy to be part of this session, and therefore I'm listening to the talks carefully, and I think it was a wonderful session. And I think you've included a lot of things about regeneration, ovarian regeneration, etc. I think it will be quite exciting to complete this whole session. Um, However, being an avid non-veg person, I need to object to some of these things that you have to go completely vegan. Everything, if you do in an extreme way, I mean, in my opinion, anything, whether it be exercise, whether it be diets, if you go extreme, I don't think it's good for our body. So I think we should. I just beg to differ, but I'm sure a lot of what you said is scientifically correct, and I think we probably will move towards that. And but we need protein, especially as you're aging. We know sarcopenia is a big problem, and as you said, exercise and muscle development is a very important thing. So if you're taking vegetarian based diet, then you should promote a lot of proteins in the vegetarian diet, which I don't know if a lot of people of that age can digest. A lot of, say, chickpeas or dals, very high amount, is actually sometimes more difficult to digest. I know there are a lot of vegans and vegetarians, so they do take it, but we have to promote that as well. And when you go in for vegan, that means again you're avoiding milk in your diet. So we have to promote calcium, perhaps, as you mentioned, millets, which have high content of calcium, etc. So, as you said, there must be lifestyle medicine people who can probably then give a proper diet to people so that they can balance all these in the age of menopause. And I totally agree. Diet is very, very important so that we do not have problems with even diet is important towards sleep patterns. Okay. So I think what you said about diet is definitely okay, but I think going extreme in anything is not good. Even exercise, if they go too extreme, then you have problems. So,
Vegan, we should definitely, vegan diet is not my promotional. That was one research. So I straight
yeah,
away,
yeah.
vegan we don't promote, but somewhere this should be the predominant diet. That
Even vegan, I'm sure there must be ways to overcome the deficits that you are saying.
yeah, but
And for example, fish oil is important where that we get vitamin D, etc. So I think somebody has to really sit
Thank you,
behind.
Dr. Rekha.
Yeah. Can you, am I okay? Hello?
Yeah, we can hear you.
Yeah. Okay. So I just wanted to just add those things on to what you were saying, but I'm sure there's a lot of scientific research going on, and I agree with you, Priyanka.
Yeah,
Okay.
thank you so much, Rekha Madam, for sharing
Yeah.
your valuable thoughts with us.
Yeah.
So we move on to our the session, and our next speaker again is going to be a very renowned endocrinologist. Of course, regenerative medicine using different stem cell sources are yielding promising results in protecting the ovarian reserve and also preventing damage from senescence and also the age-related issues, and also helping to improve the fertility potential. So of late, we are seeing more and more younger girls, attaining menopause, a premature ovarian insufficiency in less than 30 years and premature menopause in less than 40 years. So which is like, it could be genetic, but also as stated earlier, everything starts in the womb. So the healthy lifestyle of the mother is what the main crux for the women to have a healthy menopause as well. So, of course, now we realize that this is a problem. We need to give them a solution, and regenerative medicine is really coming up in a very big way. But we still do not have enough data to say how effective they are. To throw more lights on this particular aspect of regenerative medicine in ovarian insufficiency, we have a renowned endocrinologist, Dr. Jayashree, to talk about this. Dr. Jayashree, over to you, Dr. Jayashree Gopal. Over to Dr. Jayashree Gopal. Can I have her CV, please? Sahiti, can I have Dr. Jayashree Gopal CV, please? Yeah. So, Dr. Jayashree Gopal is the director of Diab Endo India, Chennai, and she is also the founder trustee of the same foundation, senior consultant in Apollo Hospital, vice president of Endocrine Society of Tamil Nadu and Puducherry, recipient of Occasional Excellence Award from OTRI, and also awarded Dr. G.P. Moses Oration, and she is also REC member of the API Chennai and EC member of Chennai Menopause Society. Over to Dr. Jayashree Gopal.
Thank you. Thank you, Dr. Mala. And yes, it's a pleasure to talk about this topic. It did force me to read about it. And there's some very interesting, let me just make this. Yeah, there's some very interesting small studies that have been done. Like Dr. Mala mentioned, it is an exciting field. And I'll share a little bit about the studies that have been done and what the data is showing. So the emerging therapies that are now being used for ovarian rejuvenation and premature ovarian insufficiency include techniques like in vitro activation, stem cell and exosome therapy. Let me just get my laser pointer. Mitochondrial activation and injection of plasma, platelet-rich plasma into the ovary. So I'll be talking mainly about the therapies which have used or very promising are all animal-related studies, particularly small mammal-related studies. So I'm going to be focusing today mainly on the clinical trials which have been done using in human subjects so that we can see how we can think about applying it in the future. So stem cells are characterized by their ability to self-renew and differentiate into specific tissues. And this they do according to the signals that they receive from the surrounding environment. So the same stem cell, if you inject it, let's say, into the heart or into the pancreas or into the nerve or the kidney or the ovary, is going to behave differently because the signals they get from the surrounding milieu is very different. They are found not only in the embryonic but also in the neonatal and adult life stages. We all have stem cells in our body. The four main categories of stem cells are the embryonic stem cells, mesenchymal stem cells, induced pluripotent stem cells, and extraembryonic stem cells. And I'll talk a little bit about each and what mainly mesenchymal stem cells are the ones that have been used clinically for a lot of the sort of the conditions that they are trying to treat with stem cells. Another exciting sort of therapy or exosomes. Exosomes are factors which are secreted by, so these, when I say factors, they could be either proteins, they could be microRNAs, they could be longer RNAs, they could be cytokines. But basically, they are all of these types of factors which are secreted by the stem cell into vesicles, extracellular vesicles, so little pockets of material coming out. They can initiate repair and regeneration processes. And probably this is one of the reasons why injection of stem cells into an ovary which is not working as well as it should is working well because of the secretion of these exosomes. It is postulated that potentially if we can just not even inject the stem cells into people, just get stem cells, remove the exosomes, remove the specific exosomes that are going to help rejuvenate the ovary, it could potentially come about as a safer alternative to stem cell therapy and avoid the potential risks of a stem cell transplant. But this is very, very new therapy, and I've not seen any studies being done with this. So the rest of the talk, I'm going to focus mainly on treatment using stem cells and treatment using the intraovarian injection of PRP, platelet-rich plasma. So coming to the stem cell therapies, embryonic stem cells are sort of the most plastic of all of the stem cells in our body. From that one single cell, all of you are aware much more than me how the human being develops. So it's got an unlimited ability to differentiate into a variety of cell lines. It could be from the endoderm, ectoderm, or mesoderm. But the problem is it can also sort of overshoot the development and start becoming teratomas. And there is also obviously a question of ethics, because how are we going to derive these stem cells? These types of embryonic stem cells are derived by disrupting a blastocyst. So, which means a potentially growing embryo may be disrupted and this is removed. However, animal models have shown that exosomes that are derived from these embryonic stem cells has been shown to restore estradiol levels, AMH and FSH to normal and increase the number of normal follicles. And they probably do by acting on the granulosa cells and activating intracellular molecular pathways, which inhibit the apoptosis of the follicle. So the theory is very good, but currently we are grappling with both the long-term side effect and the ethics of how do we obtain these embryonic stem cells. Then the other big category of stem cells is the induced pluripotent stem cells. And what happens in this is mature cells are taken and they are reprogrammed by adding other specific transcription factors. And these can then be differentiated into hormone-sensitive ovarian epithelial-like cells. But only mouse studies have been done so far. Again, there remain ethical concerns with these induced pluripotent stem cells because potentially they can continue to differentiate like the embryonic stem cells into germ cells. They can induce rejection because this is something that you're taking and you're altering and you're putting it back into the body. So potentially it can induce a rejection. And the same ethical concerns arise about how do we harvest these cells. So the embryonic stem cells and induced pluripotent stem cells, a lot of work has been done in animal studies, but no human trials have been conducted so far. So I'm not going to talk about it, but just to say they are being studied. The mesenchymal stem cells is the one that is most advanced. These are mature multipotent stem cells and they are present all over our body. They can be isolated from the umbilical cord, they can be isolated from amniotic fluid, they can be isolated from bone marrow, adipose tissue, placenta, and skin. There is really no ethical concern because you're removing it from consenting adults. They have very low immunogenicity because you are going to put it back into the same host. Normally itself, they have a role to play in wound healing and in immunomodulatory functions. The success of using these mesenchymal stem cells depends upon the age of the donor. As one can imagine, the younger the person, the more plastic the stem cells, the healthier the stem cells, and the type of collection method. Where are you going to collect and how are you going to collect it? Whether it's going to be the adipose tissue stem cell or the bone marrow aspiration stem cell, and as we shall see, some other sources of stem cells. How does injecting a mesenchymal stem cell into the ovary induce a failing ovary to start working again? It is believed that it does this through paracrine signaling. The microenvironment of the ovary is altered. So there are many intracellular molecular pathways that have been studied using mouse models. And I just put up this picture to say that it's an extremely complicated signaling pathway, not one single answer. But the injection of these mesenchymal stem cells has a reciprocal relationship with the ovary in function. So it is also getting acted upon by the signals coming from the ovary. It is also giving out certain signals, and it alters the milieu inside the ovary so that granulosa cells start developing, follicles start developing, and as we shall see, it does lead to some good outcomes. The sources of the stem cells that have been studied in animals include bone marrow, adipose tissue derived stem cells, and you can look at the effect. For example, in the adipose tissue derived stem cells increases the proportion of healthy follicles. Menstrual blood derived mesenchymal stem cells has been shown. So just every time there is this menstrual shedding, we are losing a number of stem cells, and that can also be used as a source. Umbilical cord mesenchymal stem cell, what will be discarded can be used. Amniotic fluid stem cell, again, what is discarded contains a lot of stem cells, potentially can be used. So these are all the various sources of stem cells. Placenta mesenchymal stem cell, and like I mentioned earlier, induced pluripotent stem cells. So mesenchymal cells are found all over our body. Various sources have been used in animal studies. What about the human trials using stem cell therapy in POI? So there are only about 4 or 5 well-conducted studies that I could find, and I'll just go through them quickly. This was one of the earlier trials. 9 women with premature ovarian insufficiency received autologous adipose-derived stromal cells. And in all of the trials, if you see, whatever injection is being done is only done into one ovary. So in this, the adipose tissue-derived mesenchymal stem cells were injected or transplanted into one ovary. They were followed up monthly for 1 year. And this was a study from Iran, which seems to have a lot of the literature coming out. Exclusion criteria. Obviously, the usual exclusion criteria, but including things like congenital abnormalities of the reproductive tract, other autoimmune disorders, any family history of ovarian tumors, if they've had any past history of any type of cancer or chemotherapy, any other infection, severe endometriosis. So these were all the reasons to exclude women from the, sorry, and I just wanted to point out also, it wasn't a FMR mutation type of a premature ovarian insufficiency. These were the baseline demographics. And again, I just put up the slide to say that this is the typical type of patient that we would see with very elevated LH and FSH levels and extremely low AMH levels, 0.1, 0.03 in one case. So the typical pattern of POI that we see. And the results of this study showed that the FSH levels reduced to less than 25. So the baseline being 80 to 100, the FSH levels came down in 4 people within 1 to 2 weeks of follow-up. And by the second month, it actually permanently reduced significantly into the normal range. And in 2 of these 4 people, the decline in FSH was seen at least till 1 year after transplantation. In these 4 people, the menstruation pattern, the menstrual cycles resumed. The ovarian volume, AMH and AFC were variable during the follow-up. So 4 out of the number of people who were studied, the 9 patients, responded favorably in this study, and there was no really side effects. It was safe. Another trial looked at intraovarian administration of menstrual blood-derived mesenchymal stromal cells. So again, autologous menstrual blood-derived mesenchymal stromal cells. So I presume that it wasn't clear where the menstrual fluid stromal cells were derived. Was it from the women spontaneously having a period on their own, or was it from some other source of menstrual blood? I wasn't very clear about that. But in this particular trial, 15 people underwent the procedure, and 4 out of the 15 had resumption of menses. And you can see what happened with the FSH level. It came down, the estradiol level went up, and antral follicle count went up from 0 at baseline to up to 2 after the injection. Yet another study looked at the effect of small stem cells from peripheral blood. So this was probably the easiest to do. You don't need to do a liposuction or a bone marrow aspiration. You just need to withdraw peripheral blood, but it may not be a very good source for good stem cells. But this study looked at that. In this, out of 20 patients with an average age of 36 years, 2 out of 10 had a menses restoration after 4 months. So some promising areas of success. So you can see again here, FSH levels came down, not as dramatically as the first study that I mentioned, where they used adipose tissue-derived stem cells. Another study, it was just 2 case reports where bone marrow-derived mesenchymal stem cells were injected into the ovary. Whichever ovary had the injection done had an increase in the ovarian volume. And in both of these cases, menses was resumed after 7 months, and they were followed up to 1 year. In this trial, what they did was they took allogenic human amniotic epithelial cells, and they were injected via an ovarian artery into the ovary in people with ovarian failure. However, in this study, out of the 35 patients who completed a 5-month follow-up, 20% developed hematoma and 11% developed pelvic pain. So I'm assuming that injecting into the ovary seems to be a more preferable option rather than injecting it into the ovarian vein. But irrespective of the method of delivery, significant improvements were reported in all of the markers that were followed. And 13% experienced spontaneous menstrual bleeding. 13 out of the 35. So 37% of people experienced spontaneous menstrual bleeding, and 20% reported more than one period following the procedure. This was actually a study which was published from India. I believe it was Pune Hospital, where they gave an autologous bone marrow-derived stem cell therapy, and the patient went on to conceive. And the woman delivered a baby successfully at 38 weeks. And this was published more than 5-6 years ago. And after that, I've not seen any other follow-up. But it was a 5-year-old all of you are aware of. There are a few trials being done with PRP, platelet-rich plasma. So this was a meta-analysis that was done. It is believed that
Dr.
PRP
Jayashree, your
injection
voice is
into
getting
ovaries
cut.
again helps to reset the ovarian milieu. It helps to restore the proliferation, angiogenesis, and reset the programmed cell. Sorry, can you hear me now?
Your internet is little unstable, I think. So, yeah, voice is.
Yeah. Sorry, can I just?
Yeah.
Yeah, 1 minute. Sorry, I'm just going to stop sharing for a minute. Yeah, I'll turn my video off. Is this better?
Yeah, we can hear you better now.
Can you hear me now?
Yes.
Okay, I'll just finish. I only have 1 slide left, and then I'll switch my thing. So in the PRP procedure, basically what is done is that 10 ml of blood is drawn from the person, and then the platelets are removed and they are resuspended in the plasma, and then it's injected into the stroma of any one side ovary. And what that meta-analysis showed was that clinical pregnancy, which was at baseline 14 per 1,000, improved to 27 per thousand. This was a meta-analysis done among several trials. So odds ratio, the injection of PRP seems to improve the odds, the double the chances of pregnancy. Development of oocytes was about 30% higher. Antral follicular count was about 70% higher. AMH level went up by about 10%, and FSH came down by about 40%. So improvement with the PRP injection in this meta-analysis. So to summarize and finish up, stem cell therapy, PRP injection for management of PII may become a standard or an accepted option, I think, in the next few years. However, currently no established protocol or guidelines exist, and any such attempts must go through proper regulatory guards. We still have unanswered questions about how long do the effects last, what are the long-term side effects of doing this, does it need repeated injections, do we need to do it into both ovaries, do we need to alternate? We still don't have answers to many questions, but I think the initial studies are certainly very promising. And I know that fertility specialists are considering doing this therapy. I've heard someone mention at a meeting that they do also do this. So it'll be interesting to hear what the fertility specialists in the audience think of this therapy. And I shall stop here. Thank you.
Yeah, thank you so much, Dr. Jayashree. It was really a wonderful presentation. In fact, this again is a very important and hot topic because there's so much of controversy in this particular aspect also. So, of course, now because this again, this specialty is also like, coming up, lots of researches are happening that we could see that. But ideally speaking, I don't know how much is the result of this particular stem cells. But then I think for endometrial thickness, it is supposed to be doing quite fine because even I have tried in my patients and for hysteroscopic, endometrial, subendometrial injection of this PRP is really having good effects. I think Dr. Padmaja also will like to share her thoughts on this particular aspect. So in that manner, I think it helps to improve the circulation, the thickness, and we are getting good results out of it after the embryo transfer following this. But then when it comes to ovarian rejuvenation, I have my own doubts because I don't know, but there is only one paper which you have mentioned, which was by Dr. Sunita Tandilwakar, who's going to be the current incoming president of Oxy. It is her paper, and she has one successful baby at 38 weeks delivered. After that, as you mentioned, even I am not able to see anything. So how far is the stem cell for ovarian rejuvenation is really we need to wait and watch. Though I have tried for a couple of patients, but I have not found any results. Ultimately, we need to go only for the donor. So, but what happens is like when the patient comes at such a very young age, at 25, 26, I have seen patients with absolutely nil, AMH, 0.2, 0.3 and all. So in such patients, they are really anxious. We need to offer them something and say, we have tried everything. And, you can try PR stem cells is what we can offer. But then even if that is not successful, then we have to go to the donor. So as of now, I think that is where it stays. But then how beneficial it is, we need to wait and watch only. Dr. Padmaja will be able to highlight more on this, I feel.
Yeah. So this having a primary ovarian insufficiency at an early age, now a lot of research is being done into the gene polymorphisms that are having it. So in our ovary, there are things that prevent apoptosis, and there are proteins and all which trigger the apoptotic program. So if there is a polymorphism, if we have less breaks, like suppose in a BRCA mutation, sometimes I think that is nature's way of preventing the women from having estrogen for long, because they already have a mutation and they will have a breast cancer later. So maybe nature has somehow balanced it and given them, finish off your family early, have your breastfeed your babies, attain menopause, stay healthy, look after your child, have your grandchildren. So whatever, I don't know. I mean, if you look at it from the philosophical point of view. So a lot of work is being done on these gene polymorphisms, which increase the chance of having primary ovarian insufficiency. Number one. So if it is that way, whatever stem cells we give, even these stem cells are in the same body, so it is not going to work out. One area that I feel works is they have these scanty, low aim heads, scanty follicles. So in that, the stem cells, because they're undergoing apoptosis, they have not yet failed, but they're undergoing apoptosis. So in that window period, if you can cut down the number of cells undergoing apoptosis, do an IVF fast, do embryo pooling, and do a baby, they will have their genetic way of having a baby. Having said that, lots of papers are coming up, because at Dr. Manjula Nagani and her team are they're doing stem cells with PRP injections, they're doing controls. So we need to see. But anyone randomly should not be doing it, because imagine it is a tough tissue into which you're injecting. If you're going to cause hematoma, if you're going to cause an ovarian abscess, you're going to take a person who had no health issue and iatrogenically make it worse. And what are the long term consequences? As Dr. Hichipai always says, will we induce tumorogenesis? Because we don't have any long term follow up data. So, all these data is we are looking at it for 2 years maximum. And this benefit is not going to last. So, we should have a concrete plan in mind why we are doing it, what we are hoping to achieve, and if it is a pregnancy, they need to go in within 2 to 3 months for a fertility treatment and aggressively manage it, not to do it in isolation.
True, true, very true, very true. Well said, actually. Even I have my own concern when it comes to, mutation. How are we going to stop the mutation? So we are injecting stem cells. This is going to go on multiplying, okay, there. And then we don't have any control. So the tumor formation is what is one, it keeps worrying, like what will happen to the, future of these patients. So I think there we have to really have a proper guideline and then only proceed. So. So thank you so much, Dr. Jayashree. So we move on to the next
Mala
talk.
ma'am.
Request
Mala
Dr.
ma'am.
Yeah.
Previously, we were not able to launch the model. Shall
Yeah.
we launch now, ma'am?
Okay. Yeah. Please go ahead.
Yeah.
Yeah.
With permission of
I
Chief.
request Dr. Padmaja to
Yeah.
release the medal.
Yeah.
Our
So
menopause
I
associated
heard
with
this is the
the
16th edition, and congratulations on that. And it looks like a very nice flip book, and looking at it with so many of these topics that are available is good. And you have something to stimulate the mind by Sudoku also, and that's a great book. Thank you. And coming with the festive season, you have the Kolam Center, and that looks lovely. Thank you for giving me the honor.
Thank you.
We'll move on to the next talk, and that will be regeneration of mind by positive psychology. By positive psychology, we mean the study which allows the individuals and communities to flourish and thrive. To talk on it, we have Dr. Sheila Nambiar. She's an amazing speaker, and her talks are always insightful, so I will not go more into it. She's a graduate from Madras Medical College and Kasturba Medical College, Manipal. She's both certified lifestyle medicine physician, British Society of Lifestyle Medicine. She's a fitness consultant. She's trained in positive psychology and cognitive behavioral therapy. She's a founding member and past president of Indian Society of Lifestyle Medicine. She's advisory council member of Global Positive Health Institute, certification for International Board of Lifestyle Medicine, continuation of certification, IBLM, and Lifestyle Medicine Global Alliance. She's a council member, True Health Initiative, and Asian Lifestyle Medicine Council. She is Board of Studies at Sri Ramchandra Medical College. She's an editorial board, Lifestyle Medicine Journal of BSLR, and she's author of 3 best-selling books on fitness, Get Size Wise, Gain to Lose, and Fit After 40. As I've already said, she's an amazing speaker at TEDZ and several national and international conferences and workshops. Over to you, Dr. Sheila Nambiar.
Thank you so much, Rajshri, and thank you, Menopause Society, for inviting me today to talk on a subject that is very close to my heart. I'm going to focus on mindfulness in menopause, which is what I was asked to talk about, not the general positive psychology in menopause, because that's they're slightly different. Mindfulness is a part of positive psychology. So allow me to share my slides. You see my slides? Are my slides visible?
Yes,
Yes,
Dr.
ma'am.
Sheila,
Yes,
it's
Dr.
visible.
Sheila.
Okay. So the objectives of this talk are to understand mindfulness, to understand what is mindfulness, what are the benefits of mindfulness, and how mindfulness can be useful in the management of menopause. So put very simply, mindfulness is the act of being in the moment, noticing the moment with curiosity instead of judgment. And mindfulness is based on an old, ancient Buddhist meditative practice that's now become extremely popular, and the West has actually made it popular, just like everything else, repackaged it and introduced it back to us. And there is a lot of research that is being done on the concept of mindfulness in various aspects of health and well-being, and menopause being one of them. John Kabat-Zinn, who is a professor of medicine at the University of Massachusetts and the founder of MBSR, Mindfulness-Based Stress Reduction, which is a modality that was introduced into mainstream clinical practice as a complementary form of therapy to treat a variety of illnesses, including chronic pain, depression, problems caused due to stress, and so on. Now, he said that mindfulness is the awareness that arises through paying attention on purpose or intentionally to the present moment, non-judgmentally, and in the service of self-understanding and wisdom. Now, as allopathic physicians, we're sometimes quite skeptical about alternative forms of management, but there is an abundance of research to demonstrate that our state of mind affects the expression of symptoms of a disease and disease progression, and it also can affect the way medical management can affect the disease or not, improve the disease or not. So managing our state of mind, therefore, is imperative if you're looking at holistic care. Now, the average life expectancy of about 70 years for the Indian woman, which is expected to increase to 77 by the year 2050. The average menopausal age in Indian women is 46, which is lower than that of the Caucasian counterpart. Currently, approximately 10% of India's population, that is more than 100 million women, are over the age of menopause. And many of these women suffer from symptoms and the physiological effects of the changing hormonal levels. Many of them find these symptoms quite distressing and incapacitating, reducing their quality of life. Mindfulness appears to be a very effective way of managing many of these symptoms and can be used as a complement to medication wherever required, which is what we're going to be talking about today. So it is a non-pharmacological approach to the management of menopause. Now, although HRT supplementation is regarded as the mainstay for the management of symptoms, a range of other alternative treatment approaches like stress management can also positively affect the health-related quality of life for menopausal women. We know that chronic stress can have a profound impact on health, significantly reducing not only the quality of life, but also significantly reducing the efficacy of medical treatment. Menopause can be experienced as a very stressful event by many women, and mitigating this stress by changing our perception of stress using mindfulness can go a long way in helping menopausal women, improving their quality of life and reducing chronic disease and increasing longevity. So non-pharmacological interventions to reduce stress and the consequent inflammation appears to be hugely beneficial, either as standalone treatment or as complements to other forms of treatment. Now, in this RCT by Alibadi et al., 66 postmenopausal women, a very small study, aged 47 to 62, they randomly assigned participants to either the mindfulness-based stress reduction group or the control group from August to December 2015. Now, the menopause-specific quality of life was assessed in both groups prior to, immediately, and 3 months after the study was completed. And the findings revealed a significant improvement in the menopause-related quality of life, as well as the physical, psychosocial, and sexual aspects of the intervention group when compared to the control group, immediately and 3 months after the study was completed. This systematic review evaluates the current landscape of non-medical stress-reduced strategies, exploring the potential for widespread implementation to improve health outcomes. Now, it evaluates 13 studies on the topic of mindfulness-based interventions with over 1,000 participants, and found from the studies a statistical significance in the reduction of stress levels during mindfulness-based interventions, but not such a statistical significance in the reduction of depression and anxiety. Now, this could primarily be because of the different kinds of mood, because there are multiple ways in which mindfulness can be taught and practiced. So the various different modalities have been used, and also the results depended a lot on self-report from the patients, which, as we all know, may not always be accurate. So they concluded that more research was required in this particular area. However, there are small studies across the board which show that mindfulness has been extremely important and effective in many, many ways. Now, how exactly does it benefit you? As already mentioned, it is simply just staying in the moment. The simple observation of your thoughts allows you to learn that they don't have to define who you are or your experience of the world, and that you can let them go or decide what you want to do with them. Mindfulness induces what we call as the relaxation response by engaging the parasympathetic nervous system, which is a voluntary, wakeful, hypometabolic state of the parasympathetic dominance. Mindfulness also increases the awareness of one's internal state and surrounding, preventing destructive automatic habits and responses by learning to simply observe your thoughts, emotions, and other present moment experiences without automatically judging or reacting to them. Now, one of the most important aspects of increasing mindfulness is an improvement in emotional regulation. We may have seen that during the menopausal period, emotional lability is high, often leading to interpersonal conflict and suffering. Emotional regulation is the ability to modulate your emotional experiences, enabling adaptive engagement with our internal and external experience, which is essential for well-being and social adaptation. Cognitive reappraisal is the conscious reinterpretation of a situation in a way that alters its meaning and lessens the emotional impact by interrupting automatic reactions and ants or automatic negative thoughts, allowing for conscious reflection. Now, reappraisal happens with the activation of the frontoparietal executive network, which is involved in selective attention, working memory, and so on, and the deactivation of the amygdala or the primitive brain. When used as a modality to manage menopausal symptoms, mindfulness-based stress reduction practices can help effectively manage stress. Some studies have also shown a decrease in anxiety, depression, and mood swings. Acceptance and self-compassion has been shown to improve considerably using mindfulness techniques. Mindfulness encourages the acceptance of the menopausal changes as a natural part of the aging process without judgment, therefore fostering understanding and, most importantly, self-compassion. Now, sleep, as we know, sleep disruption is one of the primary complaints that we hear from women in the perimenopausal period. So it improves sleep in several ways. Techniques like progressive muscle relaxation, yoga nidra, and mindfulness meditation can reduce insomnia caused by the hormonal shifts. It can also help women fall back to sleep when they are woken up in the night. Now, mindfulness also helps to create the calming evening routine to improve sleep hygiene. Mindful bedtime rituals like having a warm bath, stretching, or gentle yoga, yoga nidra, create the right environment for a good night's sleep. One of the most common reasons for sleeplessness is rumination. Rumination is nothing but a pattern of repetitive negative thoughts or a tendency to dwell on the negative feelings, their causes, and their consequences. And what mindfulness meditation can do is to prevent this rumination or help reduce rumination by training the mind to stay in the present moment instead of reliving the past or worrying about the future. It also helps a menopausal woman cope with cognitive changes. So brain fog is a symptom that's often experienced in perimenopause, and mindfulness exercises enhance attention and memory, countering the brain fog. Other grounding practices like time in nature, contact with the earth, like walking barefoot in the grass, walking barefoot in the sand, experiencing the touch of water on your skin. All these are grounding practices, and these help women stay centered and less overwhelmed by the memory lapses that they may experience, and help them to move forward without feeling anxious or demotivated. It's not that the memory lapses never occur. Instead, it's about cultivating the ability to stay calm and centered when they do occur, preventing this tailspin of more anxiety and further brain fog or confusion. Now, pain is often a symptom that has been described by menopausal women: pain in the back, pain in the knees, shoulders, and so on. Mindfulness practices can actually reduce the perception of pain. Now, this review article by Chen Lu et al. Discusses how we perceive pain and how being mindful through mindful practices can actually reduce our perception of pain. By observing the pain with curiosity and openness in a mindful way, it appears to reduce the sensation of pain. And this is even better than than other pain relieving practices like distraction from the pain, using some other distractive methods of alleviating pain. So actually focusing and observing the pain in a curious way appears to be beneficial in reducing the sensation of pain. Building a positive outlook where they are trained to reframe the whole experience of menopause, where mindfulness fosters a shift from perceiving menopause as a loss, an aging process, to viewing it as an opportunity for growth and self-discovery. Women spend half of their life post-menopause. How they view this time greatly influence how they experience it and what they can do with their lives for literally the second half of their life. So what are some of the practical tools that we can use to increase mindfulness? Meditation apps like Calm or Insight Timer offer guided practices tailored for stress and hormonal growth. Mindful movement practices like yoga, Tai Chi combine mindfulness and physical activity, addressing both stiffness and improving strength, and also increasing the mind-body connect. Mindful eating supports better nutrition and weight management, which is, of course, crucial during menopause. So as Ronald Siegel said, one of the main benefits of the mindful approach for weight loss is to help people recognize emotional eating. Very few of us eat solely based on hunger cues. We also eat to soothe anxiety, sadness, irritation, depression, boredom, and so on. Now, that's a recipe for mindless eating. You're operating on autopilot without paying attention to how you really feel emotionally or physically. Now, weight gain, as we know, in menopause is a very common phenomenon, but it has been found, however, that this weight gain is not an automatic or even a necessary byproduct of menopause per se. Rather, the lifestyle habits that are incorporated before and during this crucial period, which can actually prevent weight gain. So women who've already incorporated mindful eating, exercise, especially strength training in order to build muscle mass into their lives, tend to gain less weight than those who haven't. And this has been both studied as well as from training women over the last 20, 25 years to improve their fitness level. This is something that I have observed over and over again. Those that have been training and have been increasing their muscle mass tend to gain less fat with age than those who are doing only cardio or only yoga, for instance. So mindfulness can be applied to everything, including the act of eating. In a mindful eating practice, what do? You train yourself to pay attention to physical hunger versus thirst, emotional hunger, boredom, anxiety, sadness, depression, etc. You recognize that food is not the answer to the uncomfortable emotions and feelings. In fact, it can be actually compound the problem. For instance, mindfulness allows us to recognize various food cues like advertisements, If you picture yourself sitting in front of your television after dinner, where you are quite satisfied with your dinner and you're quite full, and suddenly the ad for ice cream comes up, you're immediately reminded of that ice cream that's sitting in your freezer. And that's what the ad is meant to do. There's an extensive research on how different ads affect people. So being aware that this is a cue that is stimulating you is extremely important. The display and positioning of food, especially addictive processed food in the stores, tempts you to buy them. The very presence of food in your close environment. For instance, if you have snacks in and around you in your pantry, you're more likely to eat it when you're bored or stressed. Now, all these things act as cues to instigate behavior, which is the eating. Being mindful of our environment, such as how food is served, the color of the plate, the surrounding noise in our vicinity, the music level in restaurants, etc., is extremely important. Did you know that eating from a smaller plate or a smaller bowl allows us to eat less? And eating in a quieter surrounding, quieter restaurant, which is less stimulating, allows us to eat more mindfully when compared to a noisy, colorful restaurant. So think about the difference between a high-end, let's say, French restaurant when compared to a McDonald's. You end up eating a lot more in a McDonald's because of the added stimulus that is surrounding you. So how can we be more mindful? There are 3 simple ways to think about being more mindful. They're called the 3 T's of mindfulness: tune in, take a step back, and trust in yourself. So tune in or notice your thoughts, notice your feelings and the physical sensations that are accompanying it. Be aware of what is happening in the current present moment. Don't judge or change anything just yet, such as labeling a particular thought as a bad thought or a negative thought, and telling yourself or judging yourself that to believing that you shouldn't be thinking those thoughts. Instead, just observe the thought. Be open to whatever is happening in the moment without trying to control it. Take a step back. Observe your thoughts without getting caught up or sucked into them emotionally. Gain some distance from your thoughts and feelings to see them more objectively. Now, when I counsel patients in this regard, I often tell them to imagine themselves sitting either on the bank of a river or on a railway platform watching the trains go by. Those trains or the leaves that are going down the river, which have fallen in upstream, are your thoughts. So you don't necessarily have to jump into the train, or in other words, get sucked into your thoughts and get emotional about it. But you can pick up the leaf that's going down the river, you can examine it, and you can throw it back into the river. So it's up to you. So being mindful means that you're actually observing your thoughts without getting overly invested in them. What mindfulness also does is a process called decentering, which is defined as the ability to observe one's thoughts and feelings as temporary, objective events in the mind, and increasingly regarded as a primary mechanism for mindfulness-based interventions. Trusting in yourself. So trust that you know what is best for you. Most often we know deep down what the best course of action is, but often we've learned not to trust ourselves, instead to follow a pre-written social script or to follow another person's expectations. So trust that you know what is best for you if you're able to observe yourself in a more detached manner. Trust that you can make the right decisions for yourself. Trusting yourself can actually help you become more aware of your thoughts and feelings and to respond to them in a more mindful manner. So developing daily mindfulness practices, you can do many things. What are some of the ways in which we can improve mindfulness, which can be incorporated into our daily lives? Recognize and observe your thoughts from time to time on a daily basis. So you can do this with a timer. You can do this on a regular basis, let's say immediately after lunch or after breakfast, but set yourself some goals where you actually stop for a few minutes and observe your own thoughts and observe your own bodily sensations. Practice mind-body modalities like yoga, tai chi, or even martial arts to get comfortable with tuning in and recognizing your bodily sensations, and also recognizing how they affect your mood, your physical body and experience of life, how your mind influences the movement and how the movement influences the mind. So be an observer to the entire process. Make simple everyday tasks like eating more mindful by becoming aware of your environment, the feelings, the thoughts, the physical sensations, the presentation of the food, everything. During any small task, even cutting vegetables can be made mindful. Even showering can be made mindful by actually making that experience deeper in a way that you actually experience actually experience the sensations of what that experience is giving you. Spending time in nature has been found to increase mindfulness and overall well-being, and there are actual practices in Japan called Shirin-yoku, which is nature bathing, forest bathing, where they are sent out into the forests and allowed to observe and take in the environment, be present with their thoughts and be present in the moment. So these nature-related activities appear to be extremely effective in increasing levels of mindfulness. Guided body scans like Yoga Nidra, mindful breathing, and mindful meditation practices can all be practiced in very short periods of time, even 5 to 10 minutes. You have Yoga Nidra can be downloaded from YouTube. You have 5-minute videos, you have 10-minute videos, and they can all be used on a regular basis to improve levels of mindfulness through the rest of the day. So the thing about mindful practices, although they may be short, even 5 to 10 minutes, is that what it does is it allows you to repeatedly pay attention to your thoughts, pay attention to the bodily sensations, pay attention to your emotions and feelings, and become more mindful through the rest of the day. So over a period of time, when one practices mindfulness, either in the form of a formal meditative practice, or where if you apply mindfulness in all these many ways that I've already mentioned, it does actually infiltrate the rest of your day, and you become an overall more mindful person. Now, mindful meditation, I mentioned about this. Mindful meditation is the practice to improve mindfulness. It's nothing but the practice of paying attention to the present moment-to-moment experience with an orientation of curiosity, openness, acceptance, non-reactivity, and non-judgment. It can be done by sitting or lying down quietly, just paying attention to, let's say, your breath, for instance. And during this process, you may observe that the mind is wandering to various thoughts about your children, thoughts about your work, or a conflict that you may have had during the course of the day. The actual act of bringing the mind gently back to your breath is the process of mindful meditation. And when you do this over and over and over again, it enables you to do it in stressful situations as well. Mindful meditation is the active and intentional practice of cultivating awareness of present moment experiences that may include strong emotions or difficult thoughts or unpleasant sensations. It cultivates both awareness and equanimity, which is an even-minded mental state or dispositional tendency towards all experiences, objects, or people, regardless of their affective valence. So the experience itself may be pleasant, unpleasant, or neutral, but you tend to not be affected by this particular experience to the extent that it gets you all riled up or stressed out. It trains our attention and awareness in order to bring mental processes under greater voluntary control, thereby fostering mental well-being and the development of specific capacities such as calmness, clarity, and concentration. Mindful meditation promotes metacognitive awareness, which is nothing but the act of thinking about your thoughts. And it also reduces rumination, as I've already mentioned. So mindfulness can be the cornerstone of a lifestyle medicine intervention for perimenopause and menopause. It complements the other strategies like Priyanka already mentioned: balanced nutrition, exercise, sleep, stress, relationships, etc., offering a holistic approach to this life stage. It's also a very useful complement without the negative side effects to regular pharmacological management of menopausal symptoms. And its benefits actually go far beyond just symptom management, as I've already mentioned to you. So I'll leave you with this quote from John Kabat-Zinn, who is the father of mindfulness-based stress reduction. He says, the best way to capture moments is to pay attention. This is how we cultivate mindfulness. Mindfulness means being awake. It means knowing what you are doing, thinking, and feeling. So thank you so much for your patient hearing.
Thank you, Dr. Sheila. That was an excellent talk and how mindfulness helps in regeneration of the perimenopausal mind. And just by altering the state of the mind, and which is very important to get over not only the physical symptoms, also emotionally, you are better at coping up all the menopausal problems that arises, and how it helps with all the other pillars of menopause and for the mind to be regenerated during the menopause. Thank you.
Thank you so much.
Thank the speakers and and the chairpersons of session 1. Due to want of time, we shall now move to scientific session 2, which is a panel on Ask the Experts.
No. Next
Followed
will
by
be the quiz, ma. Quiz.
As we're running short of time, can we have the quiz
Then
after the session 2, ma'am?
only we Sakiti.
Yes, ma'am. Shall I launch quiz, ma'am?
Quiz, ma.
Okay, ma'am.
What, ma?
Okay, ma'am. I'll start.
Yeah.
First question, ma'am. I request all the delegates to please answer the questions.
Embryonic stem cells are the doping used among sources of stem cells. True, false.
Last 5 seconds. Time up. Second question.
Menstrual blood may be used as a source of stem cells for premature ovarian insufficiency. True, false.
Five more seconds. Time up. Third question.
Stem cell therapy has shown permanent success in all people in whom it has been tried and can be touted as a cure for premature ovarian insufficiency. True, false.
5 more seconds. Time up. Fourth question.
Mindfulness practices stimulate the gut-brain axis, the parasympathetic nervous system, the ATP biosynthesis.
Five more seconds. Time up. Fifth question.
A well-researched modality for stress reduction is A, EMDR, B, MBSR, 3, ECT.
Five more seconds. Time up. That's it, ma'am.
Thank you, Sahiti. Enough. Thank you. Now we move on to the next.
Next, we would like to move on to a session 2, which is a panel on Ask the Expert. It's a privilege to introduce the chairperson, Dr. Radha Madhavi Madam. Madam is a founder president of Tiruvannamalai OG Society and is a director of Rajam Multispecialty Hospital and Rajam Institute of Paramedical Sciences. She's a joint secretary and EC member of TN4, and she's a practicing gynecologist since 1994 till date. She has visited multiple papers in AICOG. Welcome, Madam. May I now introduce the moderator for the session, Dr. Deepa Tyagarajanmurthy, Madam. Madam is a consultant obstetrician gynecologist with specialization in infertility. She's a director at Sai Women's Clinic, Chennai. She's a visiting consultant in Motherhood, Rainbow, and Cloudline Hospitals. Madam is an MRCOG Part 3 examiner and the executive committee member of ATN RCOG. Welcome, Madam. I request the chairpersons to introduce the experts.
Good evening, everybody. It's a great privilege and honor, and I thank the organizers of CMS for this honor. I would like to introduce Dr. Priyanka Udawat, qualification MD DNB, fellowship in pediatric gastroenterology, and she is a consultant pediatric gastroenterology and preventive health care and wellness. Current institution is Institute of Gastrosciences, HN Reliance Foundation Hospital, Mumbai. Earlier, she already gave a wonderful talk, and she is director of the Indian Society of Lifestyle Medicine, adjunct faculty Lifestyle Medicine, James Lind Institute, Switzerland, and institute mentor for Madhvidya Peeth, Jaipur. Years of experience is 13 years plus, and her area of interest is food allergy, pediatric endoscopic intervention, GI and liver wellness for all age groups. Number of publications are 30, including original research, chapters, and guidelines. Welcome, Dr. Priyanka. Our next panelist is Dr. Jayashree
Madam,
Gopal.
sorry, I've been fully introduced. Thank you. I think we can just go on in the interest of time.
Thank you. Dr. Sheila Nambiar is an obstetrician gynecologist who gave us a beautiful talk right now on mindfulness. And she's a fitness consultant, lifestyle medicine physician, trained in positive psychology, founder, member, and president of Indian Society of Lifestyle Medicine, council member.
Introduced.
Thank you so much. And welcome, board ma'am.
Thank you, Dr. Radha, for that nice introduction.
Thank you, Jayashree.
Thank you.
We'll continue with the panel, Dr. Deepa.
I think Dr. Deepa is frozen.
Dr. Deepa Tyagarajanmurthy.
Yes, ma'am.
Yes.
You are audible.
Dr. Kalaivani, we didn't introduce you. Please put the slide, Dr. Sahiti, please put Kalaivani.
It's okay, ma. It's okay. I'm just proposing the vote of thanks, no problem. Your slides are visible, pa?
Yes. Go to slideshow, ma'am.
Deepa?
Next slide, ma'am.
Kalai,
Deepa?
let's find out what happened.
Deepa, you're not audible. Okay, now.
Okay.
You can start. Already we are running late, I think.
Can you see the slide?
Yes.
Ma'am.
Questions. I think most of the questions have been answered already. So the first question is to Dr. Sheila. A 53-year-old postmenopausal woman with severe menopausal symptoms, which is affecting her work and quality of life, with sleep disturbance and severe hot flashes, does not want any hormones. Because else we can give her.
Sleep disturbances, severe hot flushes, does not want any hormones, family history of breast cancer
Can you
in
hear
mother.
me? Am I audible?
Yeah, you're audible, Deepa. Yeah.
Deepa, you're breaking up a lot. I think it's your connection. Maybe you can just turn the video off. There's a lot of lag. Sheila, you're on mute, Sheila.
Sorry, shall I go ahead with his? So,
Yeah,
Yes,
yeah.
yes, ma'am.
yeah, this woman needs extensive, what we call as motivational interviewing initially, which means that the history should not just encompass her symptoms that are current, but her past history, her diet history, her history of exercise, history of relationships, very important, sleep, addictions. She may have addictions that we may need to address. Once you get a holistic picture of what she is, where she's coming from, and what her real issues are, which one can kind of ascertain there will be something that is out of balance. Usually it is diet, usually it is lack of exercise, usually, of course, it is sleep disruption in many cases. Sometimes it could be stress related to a relationship with a near and dear one. Now, these things need to be addressed holistically before we move on to actually doing anything else. So ongoing process of, and a lifestyle medicine consult doesn't end with one consult. You have to go back to the patient, or rather the patient has to come back to you. It's an ongoing process. So once we delineate exactly what the issue is over a couple of sessions, then you start introducing small things like meditation. You start introducing, and not meditation in the classical sense. You don't have to sit and meditate. Many people are not comfortable with that. It could be meditative practices like walking meditation and the other ways in which I had described in my talk, and also introduce exercise, especially things like yoga and definitely strength training, and find ways to improve her sleep, address her relationship problems, which could be sexually related, which could be related to personality differences or whatever it is. So it's not just one answer. I think this goes beyond just the introduce meditation or introduce yoga or introduce exercise. It has to be a more holistic approach, and it's usually not really covered with one session. It has to be an ongoing process.
So, would you advise cognitive behavioral therapy?
Yeah, there are different reasons why we do cognitive behavioral therapy. If you find that she is, constantly misinterpreting her relationships or conversations, or acting in inappropriate ways, even the emotional lability that we see very often in menopause, yes, CBT will help. Not everybody requires CBT, and not everybody is actually open to CBT, because it requires some amount of instruction and restructuring of the behavior, not just the behavior, but the thoughts that are preceding the behavior, the stimulus that precedes the thoughts. So not everyone, and it is a slightly long process, not as long as psychotherapy, but definitely a long process. So we have to assess the client to see what she's open to. Sometimes it's just a question of allowing her to talk and allowing her to express herself in a way that is that she feels heard, and then when she hears the guidance, it's not really instructions from the doctor. As a lifestyle medicine physician, you're actually a coach rather than a doctor. So it's not about instructing her and telling her do 1, 2, 3, 4, 5. It's allowing her to find her own solutions. CBT is one aspect, and you can most certainly recommend it if you feel that this particular woman requires it.
With that, I'll ask one more to you, ma'am. Menopause also coincides with a lot of changes in the family.
Yeah.
Children leaving home, children getting married,
Yeah.
losing their parents, lowered libido, fighting with partners, women present with many psychosomatic issues.
Yeah.
Now, gynecologists do not seem to have the time to patiently listen to these women and talk to them. Can mindfulness alone be able to heal them and alter these somatic issues? Is
Yeah.
there a mindfulness program which is available?
Yeah. Absolutely. Mindfulness has been shown to reduce psychosomatic symptoms because these psychosomatic symptoms are based on stress. The background is stress, right? So the body has to have a way of expressing itself. And one of the ways it does that is through pain or through disease processes, including things like depression, anxiety, and so on. So mindfulness practices where you are actually stopping to, as I said, being in the moment, observing your thoughts, and so on, can certainly help. And yes, there are mindfulness courses like the mindfulness-based stress reduction course that's available from John Kabat-Zinn, as well as I think Richardson also has one. Richard Davidson, I mean. So one can source that. Alternatively, the easier thing for a patient is to use an app like Calm or ones that I've told you. Calm is one of them. It's easy to use because you have different levels of mindful meditation, and they take you through the instructions, so it guides them through it. So it can be a 5 minute, 10 minute, depending on the time that is available. Yoga Nidra is another aspect which it's actually non-sleep deep rest. That's what yoga nidra is. So that's also a form of guided meditation. So you just need to listen to it, lie down or sit down and listen to it. And this has been found to actually reduce levels of stress, reduce levels of agitation, increase the parasympathetic stimulation, and help her to calm down. And the cognitive restructuring that happens where she realizes that a lot of it is what she is projecting rather than the reality. Even the slide I showed you about the pain and focusing on the pain and not judging it, not being overwhelmed by it, rather than observing it, these kind of practices appear to actually benefit these women who have so-called psychosomatic. Obviously, we first have to ascertain that it is not organic and it is indeed psychosomatic. But if you find that it is, yes, these things do seem to help.
Thank you, ma'am. Thank you. That was really, really good. Question to Dr. Priyanka. How do we find out if the perimenopausal woman has the gut microbiome issues?
So, see, when
will she have any symptoms related to the gut, or is there any test available?
So shall I answer now or yeah? Okay. So see.
Yeah, please do.
Yeah.
Please do.
Yes, ma'am. Yes, please. Yes.
So when there is a gut microbiome issue, as such, we will have an indirect symptoms, like you may have gut related issues like chronic acid reflux, chronic bloating, or unexplained diarrheas, or sometimes chronic constipation. So these are GI related issues, okay? But patient may present having gut dysbiosis without GI symptoms. So that may be depressed mood, lack of interest, lost a lot of food cravings, or not eating well. So there are non-specific symptoms because gut microbiome governs all entire metabolic issues. So but yes, there is a little bit, you have to ask about the stool frequencies, consistency of the stool. These are some certain things which we should think. And then these patients develop a lot of allergic reactions because gut permeability, leaky gut also starts. So we should always ask whether you have skin rashes, joint pains. These are indirect manifestations of gut microbiome issues. They develop autoimmune issues, autoimmunity develops. So sometimes they develop even urticarias and rashes also. In some of the cases they say I have joint pains. So these indirect symptoms, so GI symptoms and non-GI symptoms, both we have to ask. And even just a depressed mood itself says that probably your gut health is not good, or just a simple sugar craving. If we have sugar cravings, it's basically gut bacteria which need sugar, not your brain. So it's basically all those addictions, a craving comes from the gut bacteria. Okay. So a lot of migraine issues, all these are actually because of gut health. So, and repeated infections. If you have a history of repeated infections, sometimes they are coming with urinary tract, sometimes they're coming with throat infections. It's basically their immunity has gone on toss. So immune
Correct.
dysregulation happens. So whatever can present with immune dysregulation, it is an indirect manifestation of gut dysbiosis.
Oh.
So
So
the
would you add?
history I ask always when it started, and before that, what was your lifestyle? What was the insult in the stress, or whether it was an travel major shift, or there was a bad food for very long time. Because if they are shifting to US or coming back to India, there is a major shift in their diet. And after that, they started having these gut issues or indirect allergies. So this is how the sequence of events we have to ask. So that is
So
one
we
thing.
need to spend some time in eliciting a proper history.
Yes. As Dr. Sheila also said that, it is a repeatedly, you have to ask repeatedly, you have to have follow-ups. It will take time. It cannot happen in 5 minutes to assess the gut health actually. If you just say, I don't have acidity, I don't have pain, that doesn't mean that your gut is good. If you are having migraine also, you have gut issue. It's like that. So, so symptoms I told you, non-GI symptoms and GI symptoms. If you have adult onset allergies, adult onset autoimmunities, adult onset urticarias, all these are also gut related symptoms. So
So
test,
would
yes.
you advise a diet change in all women coming with menopausal symptoms?
Yes, not even all women. I advise diet change in each and every patient who comes now, because 70 to 80% people are now thinking that the normal food industry, whatever they are providing, is a normal social influence. So each and every person, each and every consultation requires a diet revisit for sure. Because we become ill when there is a gut dysbiosis and immune goes down, and then you get an infection or whatever. Otherwise body goes into balance, if there is no gut insult. So in test I would suggest at least check their CBC. Simple thing, CBC and CRPs will tell you inflammation. If they have high platelets, that means there is a gut inflammation. If they have low hemoglobin, that means there's gut malabsorption. If they have high CRP, then definitely they are on inflammatory state. And simple stool routine. If there is a organic GI inflammation going on, then there'll be pus cells in the stool, blood cell in the stool. Then fecal calprotectin is one test which I do more often, because everybody can't go into endoscopic interventions, endoscopies, because it's an invasive procedure. So if calprotectin is normal, then we think, okay, there's no organic GI inflammation, we have to work on diet and probiotics. But if the calprotectin is high, stool shows blood, then definitely we have to go for endoscopies. And if you have indirect symptoms like fatty liver, obesity, then also we have to work on the indirect issues. And the another thing we have is stool gut microbiome analysis. So stool gut microbiome analysis gives you exact score whether you are into healthy zone, unhealthy zone. All types of bacterial species comes with their colony counts. If they are in the normal form or they are in the low range or high range, they give the scores. And then they give the metabolite profile also, how much short chain fatty acids, everything comes in that, even fecal calprotectin reports. So it's a 40-50 page report which you get. And then you get the which plants you should eat, which avoid maida, avoid junk food. All that guidance also goes with the stool gut microbiome report. It's a costly test. It's like a 16 to 18,000 rupees test. But if you know,
Do all labs do that?
no, there are certain labs only which will be doing, but it is not a usual test. I will not say that you should start doing stool gut microbiome analysis, because after this also finally the answer is holistic approach, which we all know. But yes, we can do probiotic supplementations, diet change, and if you have an organic disease, we should not miss that. So like if there's a chronic gastritis, H. pylori, all that you have to do with the endoscopies.
So leaky gut, can it be healed completely?
Definitely it can heal. And I have a lot of results with when I do skin prick allergy test. Multiple sensitizations are there, allergies are there, and repeated infections. But when we start working on their diet, After 6 months or 1 year, when I do repeat the positive ones, 80% becomes negative. That means leaky gut polysensitization is going down. If we see their stool and calprotectin reports, they become normalizes. And the way how we detect it, that you don't get infection so easily, you have better digestion, and there are no nutritional deficiencies, and there are no allergies. Or if you are genetically allergic, then at your episodes and intensity of allergies will go down. So these are all indirect markers which we will say yes. And their mood, they are now more positive, not depressed, they are sleeping well. These are all indirect signs that you can say that yes, it is healing well.
So you gave us a lot of insight about the diet which needs to be taken. Is there the best anti-inflammatory diet which you can recommend?
So according to lifestyle medicine, we have this, I shared a slide on foundation nutrition prescription. So there's an ACLM plate picture I showed, where you have 50% of fruits and vegetable one side, and the 1/4 corner was the whole grains and 1/4 was the plant proteins, and some herbs, spices, dry fruits, seeds. If we maintain this proportion and composition and variety, this almost covers everything. We don't promote going vegan completely. We don't promote that you should never eat non-veg. But what we do practically is just reduce. If you are if you are eating non-veg every day, eat alternate days. That way. But please eat the other millets also, other fruits also. So the variety. See, gut bacterial diversity needs to be maintained, and that diversity can be maintained only by variety of whole grains and fruits and vegetables, by variety of fiber.
So now there's a lot of people selling probiotics on Instagram. Are they good, ma'am? Something like Good
See,
Bug.
we have certain companies like Antrogermina is a good company, Sanofi, VSL is one of the good brands. Yes, definitely we give probiotic for minimum 3 months. I give different probiotics, not only one. We give different probiotics for sequentially, so that we get good bacteria. But only giving probiotic doesn't help, because we have to give food to the probiotic. And that food is actually a balanced diet, which becomes a prebiotic. But
So
what
marketing
people, what they are doing, they are just promoting their supplements. They are not saying that you have to eat good. You need a soil. When you are seeding something, you need a good soil. So you cannot just depend on supplements if you're not changing your diet.
True. Very true. Super. And gut microbiome has relationship with breast cancer. I saw some of your slides also said it has got relationship with breast cancer. Can the cancer risk be reversed by changing the diet?
So now there is a lot of research, and in lifestyle medicine, we read straight away there was a trial on prostate cancer. Even in breast cancer, there were trials where they have seen the epigenetic change. Cancer related genes were down regulated. The mutations were down regulated with intensive lifestyle treatment. Okay. So breast cancer, there is data. On prostate cancer, definitely there's a data. And we all know that breast cancer is because of hormones and obesity and a lot of other things. So when we work on gut microbiome and maintenance of weight, ideal weight, that itself actually changes our epigenetics. And in that way, yes, definitely there's data, but sure and short only one thing will help. No, it's again an holistic approach.
The other question which I had was in menopausal rejuvenation with diet. So what do you do when the ovaries have been removed in a person by surgery? Will this diet change and all that be enough to activate or reactivate the estrogens from the extra sources, extra ovarian sources?
When there is a ovariectomy or something, I think we always take an official gynecologist consult for hormone replacement therapies, because it's a premature, withdrawal. So which will require a guidance from you all as an expert. But what data says, what research says, that we can reactivate the estrogen, how I told you, by deconjugation method and activating the extragonadal tissues. So that can be, at least can be preserved, and then we can, because estrogen also works through inflammation and, cardiometabolic factors. So if you're keeping in control those things along with the gut microbiome, this will help. But only labeling that in premature ovarectomies and all those things, that only gut microbiome can help, I don't think so. The research will only tell that how much potential that has.
Sure, ma'am.
But
Thank you so much.
definitely I have stopped hormone replacement therapies post-menopausal women just by treating gut health.
Fantastic. I learned a lot today, actually. I have only one more question, ma'am, before we finish, to Dr. Jayashree Gopal. Dr. Jayashree, 45-year-old woman, your talk showed a lot of papers which mainly concentrated on younger women. And for irregular cycles, she has infertility and she's requesting ovarian rejuvenation. Are we justified in doing this treatment?
I think, Deepa, I answered the question on my last slide.
You did.
Any treatment, whether it's a young person, old person, has to go through regulatory approval. You have to get an ethical clearance. It has to be done as a study. And this last one that you said about some Bangalore consultant, I have not come across the published data.
They have not published it yet. That's why I just wanted to ask.
No.
They've done a series of 150 patients with bone marrow stem cell.
Maybe they're doing it as part of a. It has to be part of a trial, or at least people have to know that you have to get ethical committee approval and do it.
Which is the regulatory body that gives license
Thank you so
for
much
all
to all
these,
the
madam?
panelists, and it was really fantastic person.
Ma'am, which regulatory body gives license? Because people are just practicing on their own. Many times we come across cases like that where they have given an autologous ovarian regeneration therapy and are coming.
I know, but what I'm saying is, by law, this has to come under the thing of a trial. And you have to approach the ethical committee of the hospital that you're working at, or an external ethics committee, and say that I propose to do this. This is the data. These are the side effects. An ethical committee has to give the clearance. If for nothing else, to protect yourself also from a medical legal aspect. Of course, the problem in this situation, I think, is that women are willing to do anything.
That's right.
If they feel that it's going to let them have a baby. And we have to be extra careful in that. Even if you do it on a one-off basis, saying, we are trying this, it has to be done with the consent, with the agreement that this is a completely trial therapy, experimental therapy. And large numbers, certainly, I personally think it has to come under I'm sure they've got some sort of an EC approval.
So what they're telling is they prepare this bone marrow stem cell and inject it, and within 2 months, they go in for a fertility treatment and see whether
that may be, but what I'm saying is currently it is not under any, it has to be done with the proper acceptance, either as part of a trial or at least putting it in front of some regulatory body to say it's okay to do it. Otherwise, no. Currently, it is not
approved.
It's not at all an approved or even recommended type of treatment. Yeah.
Any more questions? Dr. Radha Madhavi, do you want to ask any questions?
Especially nowadays, this gut microbiome, lot of companies are coming up with lot of tablets. Which is ideal, we do not know, and because it's very costly. They say 75 rupees each tablet twice a day for 6 months and all that. Dr. Priyanka, what do you suggest?
I normally give, right now I don't promote these, different kinds of good bug and this and all. I always say that these are certain probiotics, which is like, long, very old companies like VSL is a good brand, or Enterogermina is one of Sanofi. And so only good companies you should purchase, not whatever marketing gimmicks, because there was a study from South India. They compared the spores of different probiotics, And if they were claiming that there is a Bacillus clozi in that particular probiotic, the spores were of something else only. 5, 6 they have compared. So nowadays this has become that we don't know actual spores, their quality. So I always prefer only long-standing pharma who are there in the field for last 25 to 30 years on these probiotics lines, because the storage is an issue, safety is an issue, and they are just putting labels with different spores, and then you cannot keep them outside. So there are a lot of things which we have to work on probiotic safety and guidelines. So better I would suggest that like good companies are like Sun Pharma, Zydus or Sanofi, something like that. Don't go with the new brands, new companies, and especially these marketing products.
Thank you.
Sure, ma'am. Thank you so much.
Is important.
So we've done with all the questions. Anything else, Shanti ma'am? Do you want to say anything? Shanti Gunasingh ma'am?
No, what about the quiz result, ma? It was a wonderful reverse panel, and we had very good practical inputs, which will really help us in managing our menopausal women better. Okay. So really, I thank all the people. And what about the quiz result, Amma? Is it ready?
Yes, ma'am. Just give me one more minute, ma'am. I'm
Yeah,
almost
yeah, yeah,
arranging the slide.
yeah. In the meantime, if the experts, any of y'all want to give more input, you can add on, please, while we are awaiting the quiz result.
I think the topic was excellent, ma'am. Topic selection was excellent and eye-opener. The amount of details which each speaker gave was tremendous.
Yeah, I think we should know what is new in the field also. It will take some time for things to establish, but I think, and small changes can easily be made. So many things what in our gastroenterologist said, or what our lifestyle medicine specialist said, all those are doable things, which we can pass on to our women.
Absolutely.
And we should understand that treatment is not about tablets alone. It is lifestyle which seems to determine everything now.
Yes, yes.
Yeah. And even chronic diseases have some limelight, so that we should remember.
True, ma'am.
Should have good circumstances to follow all these things also. I
No,
mean,
mindset, being mindful and yeah,
Mindfulness goes
mindful
a long way.
behavior.
Ma'am,
Yeah, that will
if I
result
may say
in.
something,
Yeah.
Yes,
I always say I'm also a gynecologist, so I always say that as a gynecologist, you don't necessarily have to have your own baby. As a cardiologist, you don't necessarily have to have an MI to treat an MI. But as a lifestyle medicine physician, you have to practice lifestyle medicine if you want to actually talk to your patients. Because unless you understand the difficulties, it's very easy to sit down and say, go for a walk, exercise 3 hours a day, whatever it is. But unless you actually do it yourself and realize that, you may actually exercise, but there comes times in your life where you're not able to do it. There come times in your life where you're stressed and you're stress eating. When you experience those things, your compassion for the patient and your compassion for women who are struggling with these problems increases to a great extent. And you're able to be more effective in your counseling.
Very true.
What Sheila says is
Counseling is
absolutely
absolutely true.
100%.
No, even at home, my sometimes your parents force you to eat more. So you keep telling when you're advising so many patients to stop with 3 idlis, how can you make, if we go and eat 4 or 5 idlis, then how can we sit and advise the people sitting in front of us, isn't it?
I think we should not cook tasty food at home.
No, no. You enjoy healthy food.
Tasty food we should only taste, not eat.
No, no. You enjoy it, relish it.
Slowly, slow eating.
Yeah. Amma,
Quiz results are out now.
Results are out.
quiz result, Amma. See, I'm very particular
ma'am.
about this quiz results. Okay. Oh, madam, our Savitri Subramaniam, madam, Subramaniam, madam has stood first, and she's has very fast fingers too, very nimble, agile fingers. So I think we should be really proud of her and follow her footsteps, or rather her fingers. And congratulations to Dr. Chitra Prithviraj, who has stood second. And both of them have got all answers correct. We are really happy and proud of all of you. Yeah. Thank you.
Thank you.
Yeah. Now we have come to the, yeah. Who's
Thank
proposing the oath of
Yeah,
thanks?
yes, madam.
May I now invite Dr. Kalimani Madam to propose the vote of thanks. Madam is the Director IoT Common Women and Children Hospital Egmore and is an honorary treasurer in
It's okay.
OCM.
Okay, it's indeed a great honor and pleasure to propose a vote of thanks for this wonderful webinar on regenerative medicine in menopause. My sincere thanks to our President, Dr. Shanti Gunasingh ma'am, and our eminent Secretary, Dr. Meera Raghavan, to have organized this CMS, which is actually a different kind of topic for discussion. I think everyone enjoyed it. I like to thank our chief guest, Dr. Padmaja Madam, and our guest of honor, Dr. Rekha Kurian, for their various inputs and suggestions on this topic. My sincere thanks to our chairpersons for the first session and second session, Dr. Kartika Prabhu, Dr. Mala Raj, Dr. Rajashri, and Dr. Radha Madhavi for chairing the sessions. I like to thank our first speaker, Dr. Priyanka, for her wonderful view on gut microbiome and what we should eat to maintain good health. Your talk and your answering for all the various questions we had put forth. Thank you, madam. And you really emphasized on all the food materials, how to eat, what is the food palette we have to follow, what is the glycemic index, and the carbohydrate content, as well as your fiber content. It was really an eye-opener. Next, I'd like to thank Dr. Jayashree Gopal, who gave us important update on ovarian rejuvenation, where autologous menstrual fluid, amniotic cells, and blood derived from stem cells, all these can be used for ovarian regeneration therapy. Maybe this could help us in future when we are dealing with these patients, because we come across most of, premature ovarian failure nowadays. Next, I'd like to thank Dr. Sheila Madam on giving inputs on regeneration of mind by positive psychology, her main mindfulness in menopause, how it helps us to cope up with stress, anxiety, reducing the perception of pain, and to have a good sleep. Ma'am, really, your talk was really mesmerizing. And what carry home message I took was be mindful in all the small things that you do every day. So if you are mindful in those things, really it brings you great happiness. Next, I like to thank Dr. Deepa, our own EC member, for moderating the wonderful panel on regenerative medicine. And many of our questions and whatever we thought were really covered and were answered. I finally like to thank all our participants who had logged in and all the people who had participated in the quiz. Really very happy that Dr. Savitri Subramaniam ma'am had won the quiz. Thank you, one and all.
Yeah, and I would like to place on record the great work done by Sahiti of Shield in curating our medals 16 as well as the whole program.
Really great work by
Thank you, one
Sheila.
and all.
You are doing
Yeah.
great work in
And
organizing most of our webinars, I think.
yeah, no, I'm glad that I initially chose them, and they have been really helpful for us, especially for formatting the model, so many things. Now they know what we really want. Uh, And can we have a photo, Sahiti, of all? Whoever's remaining, I would request you all to switch on your
Dr. Sheila, ma'am.
cameras.
Yeah, she is on. Raji?
Sahiti?
Yes, ma'am. I'm taking, ma'am. Done, ma'am.
Thank you.
Thank you, Dr. Shanti. I had a great time and giving me more ideas about how we can also do it. Thank you very much.
Okay, thank you very much. So we will meet
Thank you,
again.
everyone, ma'am.
Shanti, madam,
Really
usually
happy to
chooses
be here.
versatile topics, different topics, madam.
Good night
Always
for
it is
now.
different from